This is John McCaleb with Catto&Catto Division of Hub International. I want to welcome you to the explanation of the employee benefits that you're offered from ARC. They're very rich benefits. You get them offered to you the first of the month after 60 days of employment. I'm going to go over these in detail with you. And if you have any questions when we're all through, you can reach out to our office and we'll go over them with you. Everybody will be enrolling online with Employee Navigator. It's case sensitive. You'll just follow the instructions. You'll develop your own password. You'll have to get this done within a certain period of time. HR will let you know how long you have to get this done. As you enroll online, you will see all your benefits and your costs over the right-hand side. When you finish your enrollment, make sure it's affordable to you, because once you start your coverage, what you'll need to notice on the bottom of this page here, page 5, the IRS says, once you select the coverage you want, you cannot make a change until open enrollment each year, and that is December 1st. So if you elect coverage, unless you have a qualifying event, they're listed below here, to get married, divorced, have a child, you can see them listed here. If one of these qualifying events occur, you have 30 days from the date it occurs to reach out to HR and go online with eNav to make that change. Or otherwise, you got to wait till December 1st of next year to make that change. These are all the benefits we're going to be going over here. These are your medical plans with Humana, very rich medical plans. You have two choices. You have a base and a buy-up plan. The base plan is going to be a little less expensive. On all these plans, you need to remember, if you're on this plan or any medical plan at all, the most important question that you need to ask before you access care with a new physician or new provider is, are you in my network? And your network is a National Point of Service Open Access. It's on your ID card. If they say no, you need to say, I need to find someone in network, because if you go out of network, you'll pay way more money out of pocket. If you go in network, you have co-pays for a lot of things that you'll use the plan for. So for example, on both plans, your preventive care, we'll go over those in a minute, but all your preventive care that's done in network, like OBGYN, mammogram, Pap smears by ladies, physicals by men, a lot of other things covered, done in network are covered at 100%. You don't pay anything at all. If you go to the doctor, you'll pay a copay. You go to the doctor in network, they'll charge the insurance company. The insurance company will tell you how much they cover, and then they'll send money to the provider, and it'll tell you how much you owe. But you'll pay $20 for a primary care doctor and $50 for a specialist. Virtual visits, we'll go over this in a minute as well, but this is where you can go online to Doctor on Demand and talk to a true doctor for things like cold, flu, sinus strep, pink eye, ear infection, eye infection. You don't have to leave your seat, and they'll call in a prescription for it. It costs $0 for you. If your dependents are on the plan, it's free for them as well, as much as you want to use it. As long as you're on the plan, it's no cost on the base plan for this benefit. Your deductible is $5,000. Now, your deductible is what you have to pay before the insurance company starts paying. But the cool thing is, with Army residents, once you've met $1,500 of your deductible, they will reimburse the next $3,500. So you really only have a $1,500 deductible. That's very, very rich these days. Your deductible only applies if you go to the hospital, in the emergency room, hospital outpatient surgery, or advanced imaging like MRIs, CAT scans, PET scans, and of course, durable medical equipment. So you do not pay a deductible for doctor visits. You don't pay a deductible for urgent care. You don't pay a deductible for your prescriptions. Now, back up here to ER. The ER is the worst place to go, folks. I don't care what plan you're on if you don't even have insurance. The ER is the most expensive place to go for care. So they only go to the ER if it's life-threatening. Instead of the ER, if you can't go to your doctor, if you can't use the virtual visits, you want to go to urgent care. Urgent care, like Texas Med Clinic. You go there, you'll pay $100, and they'll take care of the facility charge, lab, x-ray, blood test, urine test, things like that. They do a surgery on you. That's outpatient surgery. You'll get billed later for that. So please go find the closest urgent care center where you live or work, know its hours, and put it in your phone. It's in network. MRIs, CAT scans, PET scans go to your deductible. So folks, you will go over it a little bit. You have something called Health Advocate that your employer pays extra for you to have. They are your advocate. You can call them and they can help you find the least expensive place to get your MRI done. They help you find a OBGYN in network, any kind of doctor specialist you need to find in network. They'll find the closest one to where you live and let you know which one to go to that's in network, and they'll find the least expensive MRI for you to do. So take advantage of that. Your prescriptions, your least expensive drugs are 10. That's normally generics. And then your little more expensive generics and some of your brand drugs are 40, your non-formulators are 70. And then the drugs you see on TV advertised all the time, they're going to be 25%. So some of these drugs cost $5,000 to $7,000 to $8,000 a prescription. So just know most of your drugs will fall in these tiers here. Always ask for a generic drug when you get a drug. A generic drug is going to have a candy, it's not going to have a candy coating. It's going to be less expensive and it's going to have a different name than the brand name drug. It's going to save you money. You must take the generic if it's available. If you want to take a more expensive drug, you can, but you'll have to pay the difference in cost unless your doctor writes dispense as written. Sometimes the doctor will start you on the generic. If it doesn't work, he'll step you up to a higher cost drug. So always ask for generic drugs. Your max out of pocket on this plan is $7,900, but you get a $3,500 of that paid by your HRA. So you're in great shape. Not too much out of pocket. Now, the bottom line is you're only going to reach your max out of pocket if you have an accident, bad accident, cancer, heart attack, stroke, something like that happens. We have plans by Aflac offered to you that can take care of those for you. Okay. The buy-up plan has a little bit higher copays, and you have to pay $35 for your virtual visits, same deductible, but you pay nothing after the plan, after you meet your deductible. On this first plan, once you meet your $5,000 deductible, you co-insure means you start paying 20%, and the insurance company starts paying 80%. Once that 20% plus all your copays equal the difference between $5,000 and $7,900, you have 100% coverage after that. So $4,400 is the most out of pocket you can have on this plan. On this plan, it's going to be $6,500 minus the $3,000 that the employer is going to reimburse you on your HRA, your deductible reimbursement. So $3,000 your max out of pocket on this plan. Very, very rich plan. Now the cost, I went over these before. Mandatory generic plan, step therapy, and dispense as written. That's important to remember that. $40 semi-monthly on the base plan for an employee, $65 semi-monthly on the buy-up plan. Okay. This is just a guide that shows you a visual. The least expensive place to access care is your virtual visits or your doctor's office. If you can't use one of those, urgent care would be next. And the last resort is freestanding ERs and hospital ERs. You got to be very careful about these freestanding ERs, folks. They look like urgent care centers. They're on the major highways in San Antonio. They look like urgent care centers, but it says emergency aid is an ER. So make sure you know you're going to an urgent care center. These are the preventive services. You can go over these later that are covered 100% done in network. This is how to find a doctor at home. Doctor on demand is what I mentioned. So doctor on demand, cold, flu, sinus strep, pink eye, ear infection, things like this. Unlimited number of calls. They're free on the base plan, $35 on the buy-up plan. Save you a ton of money and very convenient. Covered RX is just an app you can put on your phone that can help you find the least expensive drug and get you some coupons on the really expensive drugs. So take advantage of that. Now, this is the HRA that I talked about. So for all employees only here, folks, not your dependents. Once you meet the first $1,500 of your deductible, you go to the hospital. Once you meet $1,500 for whatever, remember, hospitalization, outpatient surgery, durable medical equipment, ER, and advanced imaging go to your deductible. Once you meet the first $1,500, you just start turning in your explanation of benefits to Proficient, and they'll reimburse you. Now, an EOB is what you get in the anytime you have a claim, the insurance company will be billed by your provider, and they will send out what's called an explanation of benefits. And the explanation of benefits is going to tell you what you owe, what they paid, and when you look at what you owe, and then on the bottom of the EOB, it's going to show how much it's gone toward your deductible. Once your deductible is over $1,500 met, start turning those EOBs to Proficient, and they'll reimburse you. You're going to have a wellness program. You'll be hearing about this in the future through Vitality, probably starting in December. So you'll be hearing about this. ARC is very engaged in wellness. They care a lot about your all's health. They don't just care about how hard you work. They want you to be healthy. So get engaged in this plan. You'll be more healthy, and they'll probably have some rewards built into it for you. More to come on that. Now, to the dental plan. Folks, 91% of systemic diseases start with bacteria in your mouth. That's high blood pressure, diabetes, and heart problems. So you want to take care of your teeth. On all three of these plans, you can get your teeth cleaned and you don't pay anything, okay? 3 cleanings a year, get x-rays, you want those only once a year, and your cleaning and exam for free as long as the doctor is in network, okay? If you say, I want a dental plan that is just going to take care of preventive cleanings and fillings, you want the base plan. If you want a plan that's going to cover root canals, crowns, bridges, In orthodontia, you want one of these plans. Now, here's the deal. This plan here, you get your teeth cleaned, in network costs you nothing. If you get one teeth clean, that covers your cost of $4.30 semi-monthly. If you need a filling, any kind of basic or major service here, you're gonna have a $50 deductible once a year. Once you pay the $50, they're gonna pay 80% and you will pay 20%, okay, of that filling cost. On the mid plan, $50 deductible. On major and basic, you have 3 cleanings a year. But your basic service here brings in perio and endo, which is root canal. So if you get a root canal, you're gonna pay a $50 deductible, and then you're gonna pay 20% after that. You have $1,000 per person per year on these two plans. The difference between this plan and this plan here is you get 2,000. So if 1,000 is enough for you, this is the plan. It brings in major services, crowns and bridges. You pay 50% and up to 50%, and it brings in ortho, a separate benefit of 50% to 1,000 for adults and children. So on this plan here, 1,000 benefit, 3 cleanings, endo and ortho, endo and perio and fillings are covered at 20%. You can pay 20%, and then for major services, 50%, and this is a separate benefit here. Okay. On the buy-up plan, the only difference is you have $2,000 of benefits. So $2,000 here for the dental work, 1,000 for ortho. You see the cost here. It's not as important on this plan to stay in network, but it always helps to stay in network on this. You'll get an electronic card. If you stay in network, you're going to get a discount on everything done. You do not have to be on the medical plan to get the dental, vision, or anything else for your family. Vision is with Humana as well. The Insight Network is your network, electronic only. Folks, eye exams used to just be check your vision. Now they can find high blood pressure. They can diagnose things like brain tumors in a way. I had 4 people last year went in to get an eye exam done. These are optometrists. The eye exam was done. The optometrist said, you have pressure in your optic nerve. You need to see an ophthalmologist. That'd be a specialist on your medical plan. These 4 people went in to see the ophthalmologist. 2 of them were diagnosed with brain tumors, caught early by an eye exam, saved their life. One eye exam at $10 copay will cover your costs for the save you enough to cover your premium for the year. So one exam for every 12 months for eye exam. You get frames once every 24 months, up to $150 allowance, then 20% discount after that. Then you get lenses or contacts each year. You can't do them both each year to have them covered. Lenses, single, bifocal, trifocal lenses, $10. If you wear progressives, you'll pay more. If you don't want lenses, you get contacts. They allow $150 for contacts and a discount after that. Cost on the bottom. So the providers are listed right there. Cafeteria plan, this is simply a plan with Proficient. These are the same ones that administer the HRA. I talked about the deductible reimbursement plan. You can have money come out of your paycheck on a pre-tax basis up to $3,050 a year that you can use to pay unreimbursed medical expenses for you and your dependents, even if they're not on your plan. Your dependents will be your spouse and any child under age 26. So let's say you want to have $100 a month come out of your paycheck. That's $1,200 a year. The first month the check comes out, you'd have the full amount you committed to the year available. It's very important to remember. This plan runs from December to November. So if you have money going into this cafeteria plan, you need to make sure when you get to the 1st of November that you have no more than $500 left in your account. Because anything over $500 left the last day of November, you will lose. So make sure you spend it. Unreimbursed medical, dental, and vision for you and your dependents. If you're paying for dependent care, you can have $5,000 come out of your paycheck pre-tax. That's going to save you over $1,000 a year in taxes on that expense. If you're single or married filing jointly, or $2,500 if you're married filing separately. If you want to have $400 a month come out, that's $4,800 a year. You only have that $400 a month to spend on the dependent care. You must keep your receipts because Proficient may call you and ask for a copy of a receipt. You go to Walgreens, you buy some Band-Aids, cough syrup, and get 3 prescriptions filled, and it costs you $75.50. Proficient may reach out to you and say, we need a copy of that receipt. They're making sure that everything is used for eligible expenses to protect ARC. If you don't send them that receipt, they'll shut your card down after they ask a couple of times. Life insurance, your employer pays for each of you to have $15,000 life insurance. It pays double for accidental death. It's 30,000 if you die by accident. Now, make a note here and think about this on all your life insurance. Make sure that if you need to change your beneficiary, that you do it on every policy you have. If you have a beneficiary there, like your mother or an ex-spouse, the money's going to go to them, even if you don't want it to. So you got to change your beneficiary. Make sure you update your beneficiary whenever you have a change of status. Voluntary life. If that 15,000 is not enough for you, as a new employee, you have the right to buy up to $150,000 of insurance, new insurance, with no questions asked. I don't care if you had a heart attack a week ago. No matter what your health is, you can buy $150,000 of term insurance that pays double for accidental life, accidental death, with no questions asked. When you're enrolling online, you just scroll across and pick the amount you want. It'll tell you exactly what it's going to cost. It's very inexpensive. You can buy up to $200,000 total, but only $150,000 guaranteed issue. Now, if you want to buy more than 150 upfront, you'll have to answer evidence of insurability form, which is available online to you. If you don't fill this out, you'll never get it. If you fill it out, once it's approved, that's when your coverage will be issued. Okay. If you buy coverage on yourself, you can buy up to half of what you buy on your spouse, guarantee issued right now, and up to $10,000 on your children. Very inexpensive way to buy life insurance. If you don't buy it this year, you can buy it every renewal on December 1st, but you'll have to answer evidence of insurability next time around. It's your only guaranteed issue option. There's 2 employee assistance programs available to you. That's exactly what it says there. These are plans that are totally confidential, that are available for you and your family, even if they're not on the plan, as long as you're on the plan here, the medical plan, and down here is this is available to everybody, no matter if you're on the medical plan or not. Okay. So bottom line is, you have any kind of family life issue. My parents need assisted living. I don't know where to start. I have a child with a drug problem. We have a financial crisis. My spouse not getting along. Call this number and talk to them. It's totally confidential, very helpful for your health. Health Advocate, I mentioned that earlier. Health Advocate is just what it is. It's your advocate. They can help you find doctors, schedule appointments, transfer medical records, resolve your benefit issues, all kinds of help available. This is your EAP with Humana, some of the things you can use it for. The app for the EAP, Dear Oaks, this is the EAP for those that are on a medical plan, can use this one. Very good benefit. And this Health Advocate, take some time to look this over, because this is a very, very good benefit your employer pays extra for you. You need to get an MRI, you don't know where to go. They'll help you find the least expensive place to get the MRI done. They'll find you a doctor in network and set you an appointment. A little more information on Health Advocate, Medical transport. If you ever had an ambulance ride or know anybody that's been taken anywhere by emergency airlift by helicopter, you'll know those bills are very expensive. An ambulance ride can cost $800 to $3,000. Insurance companies just gonna pay a small amount, and you get stuck with the balance. If you purchase this coverage right here, $7 a month covers you and your dependents in the United States and Canada. This one's worldwide, the platinum. So in the United States and Canada, you got an ambulance ride and you get a bill for $2,700, and the insurance company pays $800 of it. You owe $1,900. You just turn that bill over to them. They pay 100% of it. Nothing out of pocket for you. The premium only plan through Proficient allows you to have all your premiums for medical and dental and vision paid pre-tax. This is a little bit on that Mazda, the ambulance and airlift. Take time to look at this. You get a little card with it. I have this plan. I'll keep it forever, because one ambulance ride in 10 years or 20 years will cover your full cost. Now, Aflac, Richard Jones is the Aflac rep who can explain all these plans to you. He'll go over them in detail, but you have the option to buy an accident plan, cancer plan, hospital indemnity, short-term disability, critical illness, or term life. These plans, the accident, cancer, and critical illness, are designed to take care of that out of pocket and more. So when you have a big accident or a cancer, you can have it out of pocket. This gives you money to take care of that, or you buy groceries or pay rent, whatever you want to do. The accident plan here is $14 per employee. I think these are saving monthly rates. Short-term disability rates here based on your income. When you go online, you'll get with Aflac to go over all this. They'll walk you through this cancer plan. I recommend if you have cancer in your family, consider this. I think children are covered free under this plan. Critical care, this covers heart attack, stroke, things like that. If you have that running in your family, consider this plan. Hospital choice is hospital indemnity, okay? These are the term life rates. Rich will go over these with you. There's an additional term you can buy. This plan here, if you have an accident, I'm not going to go over all these, but if you have an accident, it's going to start paying you money right off the bat. You're just going to turn in all your bills to them, reach out to Aflac. They'll help you put together your claim. They stack all these bills together and start paying you cash to use however you need to use. If you're checked into the hospital, it's going to give you a certain amount per day, and right up front for being checked into a hospital. They pay extra amount if you put in intensive care. There's a wellness benefit in here, I think. So look through this. Take your time. The cancer plan, when you're diagnosed with cancer, it's going to pay a lump sum amount up front here. And you get chemotherapy, all these different things, they stack up and they start writing you checks, which is what you're going to need. There is a wellness benefit on this plan for sure. Remember, your physicals are free. You get that done. You give proof to Aflac and they'll send you some money for getting that done. Hospital indemnity, you check into the hospital, it's going to cover you a benefit there. I'm not going to go over in detail, but you can look at the benefits here. Physician visit, individual coverage, lab, AMS benefit, initial. Just take time to look these over carefully. Short-term disability, this is your most valuable asset, folks, your ability to earn an income. So if you get disabled and you can't work, where's your money coming from? This policy here, you'd pay this after tax, okay? You don't pay a pre-tax because you want your benefit to be income tax free. So it's going to be 60% of your income, roughly from $500 to $6,000 a month, in your income. And you can pick a period of 6, 12, 18, and 24 months. The waiting period is 0-day accident, 7-day sickness, or you can change it. The higher the waiting period, the lower the cost. This gives you money, folks, to keep your house payment going, to keep your bills paid, keep groceries on your table. I encourage you to talk to Richard Jones about all these plans. Critical illness, this is going to cover heart attack, stroke, and things of that nature. Once you're diagnosed, it'll be $7,500 right up front, and then children $10,000. So all those are guaranteed issue. Following here, we just have some important notices that your employer is required to give you by ACA. Have fun reading these things. If you have children, pay attention to page 46 here. Say a husband and wife with 4 kids, that's 6. If your household income is below $6,747 a month, go to the top of the page and make a phone call to go online here. Probably eligible to cover your kids under CHIP or Medicaid. And to close out here, remember, everybody must go online to eNAV to enroll. HR tell you how soon you have to get that done. It's very simple once you get it going. Hilda Aguilar is in my office. If any questions on your enrollment or before you or during the year, if you have a claim issue, call Hilda at this number. We're here to help you out. All the other phone numbers that you need are enclosed here. So to wrap it up, remember, on the medical plan, always ask a doctor, a new doctor, or if you're getting set up for an MRI or something, are you in my network? Avoid hospitals whenever you can. They're the most expensive place to have care done. Avoid ERs for sure unless it's life-threatening. Go to urgent cares. Ask for generic drugs. Get your eyes examined, your teeth cleaned. You'll be in great shape. If you have any questions, just follow up with my office. We're here to help you out. Thank you very much.